Anyhow, today, even if you are a beginner, you will understand many things, but then this is not the first step. And the beginners definitely will be giving you the links. I already posted in the special batch group. One sec. You have to watch the episodes 1 to 40. How many of you are beginners? Just type B in the YouTube comment space. Just type B. B, yes, please. Just type B. Yeah, your guesses. Copy link. I am just posting the link. I'm waiting for people beginners. Just see, I have posted a link that is episode 1 to 40, small videos of 3 minutes, 5 minutes, or within 10 minutes. Just save that particular link and watch them whenever you find time. That will help you a lot to understand the sessions. And whenever you watch a video, just give me at least 1 or 2 sentences in the comment space. What did you learn? Okay. And also in the main platform. Okay. Now we have so many people in the Zoom waiting room. We cannot keep on admitting them, then inspecting them again. So at least join 5 minutes prior to the session. Because I'll be waiting you 30 minutes prior to the session. I'll be waiting for you here. Since you are learners, you are supposed to be here, right? And don't get into the Zoom classroom and try to go for dressing and other things. Okay, I know you are all electrically scheduled. Did you all save that is a playlist 1 to 40. I am posting it. Yes, just save it somewhere and watch from first episode, okay, continuously. They are very, very small episodes. Recently I arranged it so that you can understand better. Okay. I have shared that YouTube Zoom classroom chat space as well. Yes. Hope that is clear. Then we'll go to. Yeah. Let me share my screen.
Yes, sir.
Just let me know if you can see the screen. Have you to comment space? Just let me see the screen. I know I'm sharing it. Yes, this is the second session. First session we had yesterday. And sometimes you will not be able to connect it to YouTube Live because there will be batch sessions. And I'll not be able to give you the recordings. Okay, it all depends because if it is not connected to YouTube Live, editing takes a lot of time, which we cannot afford as of now. Is this visible?
Yes, sir.
Others at YouTube, just be visible, yes. Yeah,
Yes,
and this is, those who have background noise, having children and all, keep muted, okay, don't interact, you will be out. Others can interact, those who have no distractions. Try as much as possible, you exclusively spend time for OET whenever you spend some time. Or if you're cooking and taking care of kids, you will not be able to understand. And live Zoom session, always mute your mic. You can unmute your mic whenever you want to speak, interact with me or others. And video should be on always, okay? To at Zoom Plus. If not, automatic will go on. The system will eject you automatically. Okay? Yes. And practice test 1. The policy recommends that vitamin K be given to infants. Can somebody tell me? First thing is to assess the question stem. This is question stem. What I just read is known as the question stem. Okay. Somebody type in the YouTube comments field, question stem. For the newcomers, they may not understand what it is, the spelling. Please type in the word question stem at YouTube comments, please. Just type in, yeah, fast. Question stem. That's for the benefit of the beginners. The faster you do, I can go faster. Yeah, question stem. Thank you. Ajay Kumar Satyan, yes. Yes, question stem. And those who interact maximum will have chances to have one-to-one session with me. Yes, the system analyzes, and you get a crown there, super chat we call it. The more you chat, that you can get freely. Yes, question 7. This is question 7. The policy recommends that vitamin K be given to infants. Now we have to find out the keywords, hedging words we call it. Somebody please type in hedging word. Some others can type in keyword in the YouTube comment space. Hedging word. HEDGING. Hedging. Just type in hedging word. Hedging words, yes. Hedging words means keywords, means the main words. Can somebody tell me what is the main word in the question stem here? The first line is known as question stem. Please write down these expressions in your notebook, okay? We'll be continuously, repeatedly repeating the same. Yeah. What is the
policy recommends?
Vitamin K.
Yeah, recommends. Okay. Recommends vitamin K.
Infants.
Infants. Yeah, infants. Okay. Then option A, by a trained health professional. What is important?
Trained
Health professionals.
Yeah. But then where you can think of by who? Who should give the vitamin K, right?
Yeah.
The first option says who should give it? Doctor or health professional or nurse or attender, who has to give it? You can underline anything that you want, okay? Maybe if you want to trained health professional, trained, anything you can underline. That's for your own understanding. Option B, within the first month of birth.
Duration.
Duration. When it is to be given, right? First one is who has to give it. Second one,
When?
time.
Within the first month, right? Okay, time. Third one, only if they are healthy.
Condition of patient.
Absolute.
What are the keywords?
Only is the
Only.
absolute.
Absolute. So
Only
we can.
healthy.
Only healthy. Now, let me give you one warning. This is not an authentic material. Okay? There was a lot of discussions going on in one group, and most of the discussions were in the wrong track. And I have just copied some of the discussions. One concern about this question. I believe the last sentence in the paragraph excludes option C because it is mentioned that if the child vomits, the oral dose should be replaced. The child may vomit if he is unhealthy, and as it is mentioned, A is not mentioned in the paragraph. Now just somebody read the paragraph, so we'll go to other concerns discussions. Then you'll understand how unguided practice can kill your competency and get you exhausted and tired of OET practice. Yes, please, somebody can take up. Just read it.
Vitamin K administration to newborn infants. I apologize for the background noise.
Please,
Healthy newborn infants.
if there is some background noise, someone else will read it, okay? Otherwise, that will distract everybody, right? Yeah.
I got that. Healthy newborn
is,
infants should receive vitamin either by intramuscular injection of 1 mg, 0.1 ml of Ponacan mm at birth.
Yes, continue.
This is preferred route for reliability of administration and level of comfort. Whereas 2 mg oral dose of Ponacan mm given at birth at the time of newborn screening, usually at 3 to 5 days of age and in the 4th week. The last dose is not required in infants, predominantly formula fed. It is imperative that the third dose is given no later than 4 weeks after birth, as the effect of earlier doses decrease after this time. Undertaking this form of prophylaxis requires that the parent accepts responsibility and the clinicians support and advise them in administration of the third dose. If the infants vomit or regurgitates the formulation within 1 hour of administration, the oral dose should be repeated.
Okay. Now, this is a concern. I believe one concern in the discussion was this in the group. I believe the last sentence in the paragraph excludes option C, it seems. Okay, because it is mentioned, means the person is saying option C is not right, because the last sentence in the paragraph, see, if the infant vomits or regurgitates the formulation within 1 hour of administration, the oral dose should be repeated. Okay. A is not mentioned in the paragraph says. Second concern, I have not copied everything. There are more than 50 discussions. C is wrong. C is wrong. Option C is wrong because doctors cannot treat UK nationals, just not any other country, right? I have just copied as it is, okay? These are not my word sentences. Ultimately, the person is saying C, option C is wrong. Should or any other modal verb. Somebody is saying with guideline, should must be used, not must. Okay. Don't worry if you don't understand these concerns. See, how to exclude C? Concern 3, how to exclude option C? I know the absolute option is wrong most of the time. Only you said absolute, right? But sometimes it is right, so I can't depend on that. Okay, I want to know why it is wrong based on the paragraph. I want to know why option C is wrong based on the paragraph. Actually, that is the right option, I tell you. At the beginning of the paragraph, it is mentioned healthy infants, right? Yes. And explanation given by the mentor in the group, our own student, okay? One of our own students is the mentor in that group. She says exceptions to absolute are, number 1, if it is an opinion, absolutes cannot be eliminated. Second, if there is a negation, negative meaning, it cannot be eliminated. One more option is that the meaning should be absolute. Absolute word should be used and the meaning should be absolute. This is according to Father Saleen, and will add if it is non-authentic material like OET or OET online. I don't know what is OET online, but non-authentic materials. And most of you are practicing non-authentic materials. These are the few concerns. Now, do you have any idea what is the answer?
B.
B. Just type in the YouTube comment space as well. B. Somebody says B is in the first month of birth. Everybody just write down the question stem and the answer options in your notebook, because when we change the slides, it will be easy for you. Just write down only the question stem, first line, and option A, B, C. Just write down on your notebook. So it becomes easy when I explain. I can't show you everything on the screen. So write down. Write down once you have done, just give me a thumbs up at the YouTube comment space. Yeah, option B, option B, option B, option B, option B. It's option B. You are mentioning the answers, right? I don't want to agree or disagree with you. No, people are for B, 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 yes. B. Did you write down? If you have written down already in your notebook, a question stem and all the three options, the option A, option B, option C, just give me a rose or thumbs up or a smile or emoji, or type in S in the YouTube comment space so that we can continue. Yeah. Why did you exclude only? Only if they are healthy? Any idea? If there are beginners, don't worry about these absolutes. I will be teaching you in detail, okay? As you watch those, what you call small episodes 1 to 40, you will understand at the same time, we will be revising it again. Okay. Is it absolute only?
No,
It's not
only is an
mentioned as-
absolute, but further,
Yeah.
in this paragraph, the vitamin K is given to healthy newborn infants.
Only is not absolute. Why? The word is absolute, but the meaning is not absolute. Meaning of option C. Only if they are
If
healthy.
they are healthy,
Means what?
some
Some
If
infants.
if it's
some infants
open,
are healthy.
Yeah, healthy infants should be given. Means if they are healthy, means maybe out of 100 infants, 70 are healthy, 30 are unhealthy.
Unhealthy.
So you have to administer vitamin K to that 70%, so healthy infants. That is not zero or all, 100%, right? So the meaning is not absolute. Though absolute word is used there, the meaning is not absolute. Only if they are healthy means some of them are healthy, some of them are not healthy. Only healthy people will be given vitamin K. So exception 1, if you have to eliminate, there should be absolute word and the meaning of the option sentence must be absolute. Is the meaning of the option C absolute?
No.
No,
No further.
because healthy, some of them are healthy. So some is not absolute. Meaning says some healthy, some unhealthy. So it is not all or zero. Okay. Are there some people who don't understand what is absolutes? Absolute words? Absolute words means the extreme poles. All. If there is a word all OET aspirants are lazy, immediately you can eliminate that option. Or no OET aspirants are lazy, you can eliminate the 0 and 100%. Because in health profession or health field, medical field, there is no absolutes possible. You can't say paracetamol can be given to all the patients. No. No absolute position is possible in medical field. It's all subjective related to each patient. So any option giving, I'll give you examples and practice materials where you'll find, and I'll give you some 20 video links of our previous sessions where I have tackled all such problems. So just write down principle number 1. If there is an absolute word, can you just type in the YouTube comment space some examples for the absolute words? Fast, so that the newcomers can write down. Those who know some absolute words, please type in. Are you typing in? Anybody who knows, please type in absolute words. There is some distraction, okay? Those who have kept unmute, your mic is on. And there is distraction from the background. Okay. Absolute words are, yeah. Minnie Jackson says only, always, complete, all, few, little. What's the meaning of few? There are few nurses attending duty today.
Zero.
What's the meaning?
No nurses.
Zero.
No
There
nurses.
are no nurses. Few means zero. A few
Zero.
means some.
Some.
There are a few nurses attending OET session today. There are a few. A few means some nurses. Just a few. FEW is negative, means there are few nurses who are attending the session today or duty today, means there are no nurses attending the session today. Is that clear? No nurses. There is a little water in the well. What's the meaning?
No water.
Yeah. No?
No water.
Yes, no water.
No water. There is little water in the well means there is no water. There is a little water in the well means there is some water. There are few students in the classroom means there are no students. There are a few students means there are some students. Okay. Then let me see other always, almost, no one, everyone, few, never. Write down these expressions, okay? Never, only, always, and no, I'm not reading the repeated words. Entirely, okay, completely, nothing, okay, little, yeah, everyone, everything, nothing, all these are words. Okay. Can you see my second slide here, second PPT on the screen?
No, Father, the same slide.
Father.
Same slide. Let me. Okay, I'm showing one more slide. I'll just stop sharing and share again so that you can see it. Yes, when I do these things, you can send some emojis at YouTube comment space so that I get some energy. Okay. Yes. Yeah, some hearts are flying, some smiles are flying. Okay. Now coming to why language matters in OET part C, even part B. Okay. Especially in reading and listening. Number one, OET tests professional judgment, not memorization. OET tests, the exam tests professional judgment, your ability to make professional judgment, not memorization. You can't memorize and answer. Okay? So you need to understand the strategies of professional judgment. Second one, correct answers always reflect clinical realism. What is clinical realism? As I said, you cannot say a certain medication can be given to all the patients. That is not clinical realism. No doctors will say after the surgery, the patient will be 100% perfect. Okay? After a bypass surgery, what happens? You cannot say all the patients who undergo bypass surgery will be perfectly healthy after the surgery. Impossible. All is not realistic. Third one, extreme and rigid statements are rare in healthcare texts. Extreme and rigid statements saying all, no one, few. These are the extreme rigid statements. Understanding language tone helps you eliminate distractions quickly. Understanding language tone. The tone of the language helps you eliminate distractors quickly. There will be distractors. I'll show you what are they. Okay. So these are the four statements. Don't worry about it. Common absolute words in OET reading part C and B are always, never, only, completely, entirely, all, none. These are the common words. Other words also can appear, but these are repeatedly appearing. Hope you can see the screen, right?
Yes, Father.
Yes, Father.
Oh. See, what is qualifying language? Qualifying language allows flexibility, no rigidity in medical language. And qualifying language allows judgment, individual judgment, and it allows exceptions. If your answer option doesn't allow flexibility, judgment, and exceptions, if you say all, everyone, they are going to be eliminated immediately. They are going to be wrong. Common qualifying words in OET reading part C as well as D, okay, even in listening. Qualifying words, usually, that answer must be most of the time right. If they say usually, not always. Usually means not always. Often. Somebody typed in the YouTube comment space often as absolute word. Often is not absolute word. It's a qualifying word. And if the word often is used in one after the option, that must be, most of the time, that must be the right answer. Okay. May. Yeah, the patient may be perfectly all right and can work again after 3 months. Maybe. It's not an absolute expression. Maybe. It's flexible. Yeah, definitely. You can do something to build up your health. You can do something. Yeah. Most of the time, after the surgery, bypass surgery, patients recover within 2 or 3 months. That is it. Flexibility. Not all the time, most of the time. Generally, people recover very fast. Okay. Depends on. See, all these are flexible options, qualifying words. If these words are used in one of the options, that option must be the right option. Hope you are understanding what I'm saying. If there are beginners, don't worry. Okay, we'll be coming back. Just have these ideas, write down these things. We'll be explaining to you in detail in a different batch. In some cases, see, these are known as qualifying words. They are not absolute extreme words. Okay. The examples of absolute options, usually incorrect. Usually incorrect. I did not say always incorrect, usually incorrect. The qualifying word is used there. Consent is always required in every situation. What is your medical judgment? Is that right or wrong? Consent is always required in every situation. Is that true? If there is nobody to give consent, you will see that the patient will die. He will not take up the medication and other things. There's an accident case and there is nobody who can sign consent. Will you treat the patient or you will allow the patient to die?
We'll treat the patient.
Yeah,
Mhm.
that's why we said medical judgment should be allowed. Now here, medical judgment, flexibility, no flexibility. Consent is always required. Always is the absolute word. If you find such a word in an option, that option can be immediately eliminated. That option can be immediately eliminated. You may not read the text at all. But precaution is this, the meaning of the sentence must be absolute. Here, meaning also is absolute. Consent is always required in every situation. Every situation is also absolute. Every, always. So such expressions are wrong options. Examples of qualifying options. Consent should be sought when appropriate. Consent should be sought when appropriate. That can be the right answer. Telehealth completely replaces face-to-face consultations. Now only online health consultations, no face-to-face consultations. Telehealth completely replaces face-to-face consultations. Completely is absolute expression. Is that right?
No, it's
Can
not.
somebody say that? Can somebody say that
No.
all the people are consulting through telecalls? No. You can
That's
interact,
so.
okay? If you have no background distractions, you can interact. So the right thing should be telehealth can be useful, but not in all situations. Not in all situations. All is absolute word, but the meaning is not absolute. Not in all situation means
Some
useful in
situations.
some situations. Some is not absolute. Meaning is the word is absolute, but the meaning is not absolute. Not in all situation means in some situations. Useful in some situations. So that is right because the meaning is not absolute. Did you understand?
Yes, Father.
Yeah. Older adults never adhere to medication plans. Ajaji, the old people, my grandpa never adheres to medical plans. Will your statement be true?
No, someone
No.
else.
No, because you're angry with your grandpa, that's why it's not that
Mhm.
Okay, it's not realistic. Medication adherence varies between individuals. That's all. Varies between individuals. Complaints are only caused by medical errors. Only is the absolute word. People complain only because of medical errors. Is that true?
No.
No.
Not
There
true.
are many reasons why they complain. Not only medical errors, maybe the rude behavior of the professionals, or they have fought with their wife or husband at home. So there will be more complaints when they come to the hospital. Complaints often arise from communication issues. Often arise. Often is a qualifying term. So all these in this side, on the right side are qualifying options. Often they are correct options if those words are being used. And all on the left side columns, usually incorrect. Hope you understand the difference in the language. Absolute language, always. Qualifying language is usually. Absolute never, qualifying is rarely. Absolute is only, qualifying is mainly. Absolute language is completely, qualifying language is largely. Absolute, all patients, qualifying language is most patients. Obvious. Okay. Yeah, now let's see this one. Do you want to do this? Oh, sorry. Let me share again. Are you all following me?
It's Father.
Yes, Father.
Yes, Father.
Yes, Father.
Okay. Keep smiling, okay? Then you will have more energy. And looking at your smiles, I will get some energy. Yeah? Santosh is not smiling.
Sir, smiling, sir.
Okay, okay.
Thanks, sir.
I don't know how is your place, but it's very, very hot here. Extremely hot. Yes. So, yeah. Feeling. Right. Now somebody can read it down. I'll just read, then you can just tell me the heads in words, okay? What is identified as the most common cause of patient complaints? What are the keywords?
Most common cause.
Most common cause. Okay. Okay. Of patient complaints. If you want to underline patient complaints, you can underline that as well. It's all up for your understanding, not for the purpose of examiners. Okay. And option A, serious clinical errors. The meaning is this: what is the most common cause of clinical error? Okay, or patient complaints. Why do the patient complain? 4 reasons are given. Serious clinical errors.
Clinical errors.
Clinical errors. Why do they complain? Why do the patients complain? Second one, Communication problems and
Communication.
unmet expressions. Communication problems
Communication.
and unmet expectations.
Unmet
Yeah. And now here I'll give you one more clue. If conjunctions, fanboys. Who knows what are the fanboys? They are very, very important in our OET life. What are the fanboys? Type in the YouTube comment space. Those who know, at least one each. Each one type one. Fanboys. FANBOYS. Fast. Fanboys. They are very, very important. Write them down. Yeah. Fanboys. What are they? FANBOYS in capital letters. Yeah, 4. F stands for 4. FOR. Just write down, okay? If they are typing in the comment space, yes. And
Therefore,
A stands for?
and.
Yeah, and type it in the YouTube comment space. Sometimes the beginners may not understand our pronunciation. Yes. And A stands for and N stands for nor.
No.
N-O-R, nor. Thank you, Subhi Selva. Yes. And B stands for but.
But.
O stands for?
Or.
Oh.
Type in the YouTube comment space or. Yes, okay, yes. Okay, Selva. Yes. And Y stands for?
Yet.
Yet. Y-E-D, yet. And S stands for?
So.
So. Fanboys are very important. If fanboys are found in one of the options, that must be the right answer. Once you are competent, here there is a fanboy, right? That is a fanboy here. Option B.
And option B and.
And I tell you, don't believe me, but I am telling you, once you are competent, you will immediately select this as the right answer without even going to the sentence or anything. You don't need to do anything if there is a fanboy. Let's see, don't believe me. Only when you work out, see whether that is the right option. So don't forget the fanboys, they are the best friends. FANBOYS, fanboys is the abbreviation for the conjunctions. Okay, 6 conjunctions. Now, option C, only failures in medical treatment.
Only is an
Only is an absolute. Even the meaning is absolute, right? Only
always
medical
Absolute.
treatment failures. So
Also
meaning also
already.
is absolute. Meaning also is absolute. So you can eliminate. Always staff negligence. Patients complain only because of the
Always.
staff negligence. Always. What is always?
an absolute.
Absolute.
And
Absolute.
meaning also is absolute, right?
Yes, sir.
So you can eliminate. So you have only 2 options to work upon. Even if you are not confident, 3rd and 4th option is eliminated. Now, when you read the text, you have to find out patients complain about serious clinical errors or communication problems and unmet expectations. Serious clinical errors. From your medical knowledge, what do you know? Patients' most common cause of patient complaints is serious clinical errors. Means the patient is already dead. They will complain for anything and everything, right? Yeah. So from your general knowledge, you know that cannot be the right answer among these 2 options. First one is very narrow. Most of the time it is communication problems or unmet expectations. I thought all these facilities will be there in this hospital. I thought always nurses will be attending me, but I have rang the bell 3 times, they did not reach me. Okay. I thought there will be air condition in the ward. I thought there will be people to take care of me here. I thought they will. I will be able to heal myself within 3 days. All these expectations are not met. They complain. Is that true? So patients complain not only for serious clinical errors, right?
No.
Do you agree with me?
Yes.
Yes,
Yeah. Don't believe me. Just go to the passage and understand. Then from your experience, you will get it. Yeah, please read. Someone please read the text. Come on, these are the opportunities where you have to jump in and use these opportunities, okay? That makes you competent.
patient
Please, yeah, please don't
patient
scribble on
complaints.
the, 1 minute.
Oh,
Please
okay.
don't scribble on the screen. Somebody is scribbling on the screen. It disturbs. Okay, that takes my time to clean the screen. When you scribble on your screen, you'll be scribbling on my screen. Once you scribble on one screen, throughout all the slides will have that. Yeah, maybe beginners. If you are not familiar, don't write anything on the screen, okay? Yeah, maybe your children are around you. Don't allow them to. Yeah, please read.
Managing patient complaints in healthcare. Patient complaints.
Please, there is one instrument not muted. When somebody is reading, others please mute.
Kindly, I wanted to say on my end, the writings are very small. I am not able to read. I don't know whether it is the settings of my laptop or it is from your end.
What do you say, others?
I'm
Please.
saying from my end, I am not
understand.
able to read.
I understand,
Okay.
and I understand. I understood. Anne is saying the screen or the writing is very, very small. She is not able to read. What others feel? Yeah. Now the thing is this, and that's why I ask you to use, if possible, 2 instruments where you can zoom in the screen. You can fit in the phone. You can just touch with the 2 fingers and zoom in. Okay.
Father, I just used laptop for the 2 channels. I get you now. Thank you.
Yeah, even in the laptop, you can go to the font size. You can enlarge it.
Okay. Thank you.
Okay. Yeah, cool.
Thank you.
Please read, others mute your audios when somebody is reading, okay? And try to understand which is the right answer. Where is the answer? Yes.
Managing patient complaints in healthcare. Patient complaints are an important source of feedback for healthcare organizations and can contribute to service improvement when handled appropriately. Most complaints arise from communication breakdown, unmet expectation, or delay in care rather than clinical incompetence.
Yeah, please.
Effective
Anybody? No, wait.
Most complaints arise from communication breakdown and unmet expectation. Answer is there.
Answer is there, right? Then do you need to read?
No.
Further. And later on, you will learn, those who are seniors here will understand most is a scale expression. If there is a scale expression in the question stem, immediately you can look at the expression, scale expression in the text, and there will be the answer. You see here, most, right? Complaints arise from communication breakdowns, unmet expectation, or delays in care rather than clinical incompetence. First one, clinical errors. Rather than clinical incompetence. Means clinical competency is not the main reason for complaints, patient complaints. So, second, option B is the right answer, right?
Yes, sir.
Then do you need to read all these things?
No.
No.
Yeah, that's how you defeat your enemy. Who is your enemy?
Time.
Time. Yeah. So I said even before, when there is a fanboy, that must be the right answer. Now, do you agree with me?
Yes.
Yes, sir. Absolutely.
Yeah. So, send me some emojis. You should not be selfish. Okay. Yeah. I'm asking you because your mind should be always active. Then only you will understand. I can give you hundreds of examples where there is a fanboy appearing. That is the right answer. Hundreds of examples I can give. So once you're competent, you don't read anything. You read the question term, option A, option B, then immediately you select the answer because fanboy is there. Then maybe in the second visit, when you have completed your answers, you will have a lot of time left. Then you can come back and recheck whether these answers are right. If you have some doubt, mark and go. Then visit back and reset.
Okay.
Okay?
Got it.
Is that cool?
Yes, sir.
It's fun.
Yes. Do you have energy to go on?
Yeah, yes. Yes, sir.
Hmm?
Yes, sir.
Yes, Father.
Yes.
Yes,
Now,
Father.
yeah, but no smiles. Such beautiful things you should be smiling at.
Yeah.
Come on now. Second one, according to the text, which statement best reflects the use of telehealth in primary care? Question stem. What are the hedging words or the keywords or phrases?
Sir, maybe best reflects.
Yeah, best reflects. There is a scale, right? Best reflects use of telehealth in primary care. If you want, you can highlight that as well if you want. Now, option here, telehealth is always appropriate for managing chronic conditions.
Always.
Chronic condition.
It's an absolute.
Always
Always.
absolute.
Always is an absolute
Absolute.
expression and the meaning is absolute,
And
right? Telehealth
meaning
is
is as-
always appropriate managed chronic conditions. Means whenever you have chronic conditions like cancer, brain tumor, something of that sort, don't go to the doctor. Only through the phone, telehealth service you have to consult. That's nonsense,
Correct.
right?
Yeah.
Even otherwise it is nonsense. That's why I said this is not flexible and there is no way you can eliminate. But don't believe me, okay? You have to get it from your experience. But the principle of elimination says when there is an absolute word and if the meaning of the sentence is absolute, eliminate. Option B, telehealth can be useful, but is not suitable for all situations.
What is a conjunction?
But
That
is a
can be.
conjunction.
Mm.
The fanboy is there, but is
Fanboy
there any
too.
other issue now? Is there any other
Absolute,
issue?
but meaning is not
but it's
absolute.
not, meaning not
Absolute, but not
absolute.
absolute.
All situations, all is absolute, but meaning is not absolute.
Meaning is not- yes.
Not suitable for all situation means suitable for some situations.
Some situations. Yes.
And if at all they use an absolute and if the meaning is not absolute, that must be the right answer.
Yes.
Mhm.
That's the trick they play.
Mm.
If at
Yes,
all they use
sir.
an absolute word and if the meaning is not absolute, that must be the right answer. And if there is a fanboy smiling at you, that must be the right answer. When you are competent, you have nothing to do, you will simply select this as the right answer. Okay? There is one instrument to be muted. If you have background distractions, don't unmute at all, okay? Do you understand what I'm saying?
Yes, Father.
Yeah.
No, sir.
No father, yes father.
No, sir.
Yes, sir.
No, there is a no father. Now you see, you know what are the fanboys?
Yeah, yeah.
Means conjunctions. If one of the options in 4 options, option A, option B, option C, option D, if one of the options includes one fanboy, now girls, okay, no fangirls here, only fanboy. Here, which is the fanboy?
But
But if there is a fanboy, that must be the right answer 90+%. That must be the right answer option. Second clue. If there is an absolute expression like all here, if there is an absolute expression and if the meaning is not absolute, most of the time that answer is the right answer. Here there is the absolute option, right? All is absolute, but then the meaning is not suitable for all situations means not absolute. Means it is suitable for some situations. Meaning
Okay,
is
sir.
it is suitable for some situations.
Something.
How beautiful. So already selected. If once you are competent, you are selected, you need not look into anything else. Finished within seconds. You go to the next And after 10 minutes, you will be blinking and enjoying what others are doing. I have not selected any of these materials. These are sent by learners. Okay. Most of my things are sent by learners asking for clarifications and doubts. Option C, telehealth completely replaces the need for physical examination. Physical examination not at all required.
Completely is absolute.
Completely.
Yeah, even otherwise from a general sense, this sentence means that you just need to consult only through the telecalls. No physical examination is required for any cases. Can that be right?
It's wrong.
Yeah. Your general knowledge also, medical knowledge will tell it is wrong, right? Then we don't require any hospitals at all. Okay, option D, telehealth should only be used when patients request it.
Only is absolute.
Only
Should
is absolute.
given meaning also.
Only is absolute. Telehealth should only be used when patients request it. Even if they don't request, you can speak to them, doctors or medical professionals, the nurses can speak to them over the phone, right? Even if they may not know it as well. Then you can say, since you are coming from a very far place, you can just call me after a week, right? Can you do that?
No.
And tell me the improvements. That is cool, right? So only is absolute. And even otherwise, your general knowledge says that is wrong.
Wrong.
So what is the relevance of going to the paragraph? 3 absolutes, 3 options. That paragraph is given to the examiner to read. You don't need not read. Anyhow, let's just read it, okay? Just for the sake of understanding, yeah. Because some people are not smiling, they are doubtful. Will there be the right answer? Option B. Yeah, let's read, please. Smile and read.
In the paragraph fourth line, however, telehealth is not suitable for all clinical situations.
Yeah, just read. Somebody please read. We'll come to that.
Telehealth consultations in primary care. Telehealth consultations have become an important component of primary care, particularly for patients with stable chronic conditions. They allow clinicians to monitor symptoms, review test results, and provide a follow-up advice without requiring in-person visits. However, telehealth is not suitable for all clinician situations. Patient.
Yeah, that is the answer.
Answer,
right?
Hmm.
And there is another clue here. What is the clue? Somebody who is advanced can tell me.
Contrast is the
Contrast word,
word.
however.
Contrast word. Just type in the contrast words that you know in the YouTube comment space. However is a contrast word. Whenever there is a contrast word, whatever comes next will be the answer. Just write down all these principles, okay? You'll have to give me back when I ask you at the end, one by one. Whenever there is a contrast word in the paragraph, in a sentence, what comes after the contrast word will be the answer. If there are 2 contrast words in a paragraph, whatever comes after the second or the later contrast word will be the answer. If there is a contrast word, whatever comes next to the contrast word will be right answer option. If there are 2 contrast words in a paragraph, in a text, whatever comes after the second contrast word or the later contrast word will be the answer. Okay. Now, however, so at the YouTube comment space, however, what are the contrast words? But, however, in contrast, although, even though, all these are the contrast words. We'll be going in detail about it. Okay, about each principle, we'll have beginners, we'll have detailed sessions. Don't worry. Okay. Yeah, those who are out, see, some of them have gone out maybe by internet issue. That's why I said you should be signed into YouTube because you will not be able to admit in between the sections. Now they are sending me messages continuously. That's why I asked you, keep signed into the YouTube Live as well. Even if you are disconnected by chance for some internet issues from the Zoom classroom, you will not lose the session. You can continue listening at the YouTube. Okay. Now you see many of you are not in the YouTube. Only 4 are at the YouTube can. All of them, all of you, those who are here, please sign into YouTube. If you are not there, and send me a message there. I love OET, type in. All those who are here, type in the YouTube comment space. I love OET. Please type in the YouTube comment space. I love. Yes, Santosh Kumar, thank you. Yes, Mini Jackson, thank you. Josina Joy, thank you. Okay, I love OET. And by today evening, I'll be giving you Edu Skill registration numbers for real learners, those who are serious. Then in the YouTube comment space, and we can just mention, if you want to be anonymous, you can mention that registration number. Okay. Anusabin, I love OET. Yes. Yeah. Yeah. Some more, 3, 4, 5, 5. 10 more have to reach here. Those who are in the Zoom class. I love OET and Job. Yes. Tahira Ashwin, I love OET. Yes. Andrea Ranjit, I am in YouTube. I love OET. Yeah. Those who are in YouTube classroom, 10 more have to tell me I love OET there. Andrea Ranjit, thank you for the super chat. Thank you, Ansi George, for the super chat. Yeah, all of you can repeat them and get a super chat. If you type more messages, you'll get a super chat. Otherwise, you have an option to purchase super chat. Whereby you give a small amount towards the maintenance of the platform. Okay. Yeah. I wish that all the real learners have a super chat here. I don't know how do you purchase it. The tech team has arranged it. If somebody knows, you can explain it. Anyone knows it? Where is the option to purchase it? Do you have an option in the YouTube comment space itself?
Yes, Father.
Where is it? How do you understand? Please explain so that those newcomers. Yeah. How expensive is it to purchase a super chat? You have to click on the dollar icon, right?
Click on the crown button.
Click on crown.
And just,
Yeah, click.
we can see a GPay. So 10, start with the 10 or 20 rupees.
Okay. If you can afford, you can try with the 10 or 20 rupees, have a super chat so that every message has a super chat. That helps the platform to reach to more deserving people. That's a great mission. If you are able to afford at least 10 rupees, please purchase one super chat. Okay. That's how our platform runs, you know. Yeah, you can explain more if there is some procedure. I don't know because I have not done it. Once the tech team told me and I purchased it for 170. I don't find that in the computer. In the computer, you don't have that GPay icon, I believe. We have in the computer.
I purchased. Yeah,
Okay.
I purchased one time. It's with 50 rupees.
Okay.
Just start with 10 or 20 rupees.
Yeah, yeah. Super stickers also are there, right? Super chat and super stickers. In the computer, you can see a dollar icon. That's what I believe. That's what's seen in my computer. In the phone, it is GPay icon, right? I don't know. Maybe different in your own. All those who can afford, just try at least 10 rupees. Let's see. If you can afford more, that's cool. Not even a single rupee will be wasted, okay? That will reach to the deserving people.
For the Vasudev purchased with 100 rupee.
Vasuki, right? Thank you, thank you. Just you can type in what is your amount. Yeah. And you can send me a personal message also, okay? We'll consider for your generosity. Whoever purchased the super chat, you can just send me a personal message in the WhatsApp. You know my number, right? My WhatsApp number is, if they're not from India, 91 is to be added. Otherwise, 944-844-1393. This is also, this I have posted in the Edu Skills, this one comment space. This is also the key, okay? 944-844-13. If you go to YouTube for the classroom link, you can just enter by typing this number. This is the password as well. 944-844-1393. If you type in, you can enter the Zoom classroom once you are in a permanent batch. Yeah, Vasudev, I can see you have purchased 100 rupees. Thank you, Vasudev. Thank you so much for your generosity. Yeah, we have a lot of expenses maintained in the platform. There's a tech team, you have to pay them every month. Yeah, thank you. Yes. There's also not only the money that counts, but when you purchase even 10 rupees super chat, every purchase gives us more reach to the deserving people. Okay. I'm giving 2 more minutes. If you want to take some juice or snacks, grab it fast by the time those who want to purchase will purchase. Yes. Let me see at least 10 rupees everybody purchases. Let's empower each other. With a smile. All what you do should be with a smile. Okay. Yeah, Vasudev. Only Vasudev purchase. Others, I think, they said drop load. You must be drinking some water, okay? Some on your side. Otherwise, you'll have dehydration. Yeah. Always keep some snacks or juice or something at your hand when you come to attend the session. So again, you can fall in love with all. Okay. Yeah. I think some people have raised your hands. Do you want to say something? No, right? You can cancel the hand as well in the react button. Click on the react button and cancel your raised hands if you have already met your request. Yeah. Usually when you raise your hand, you'll be shown here on the screen and your hand will be seen to me. Yeah, that's fine. Yeah. You can anytime you can raise hand. Yeah, I'm waiting for others to purchase some super chats. Nobody wants to support us. See how selfish people can be here. Pardon?
Well, I already tried to, I tried to pay by the Google Pay. It shows the money deducted from the account, but in the YouTube, it shows like some technical errors.
Okay, maybe you can try again later.
Yeah, I think I need to try again. Let me see.
It will be seen here and I get a message here as well. And every time you message, a crown will be there along with your message, all your messages. You can see in the YouTube comment space. I wish that there is a crown with every message with everyone. Okay, thank you. Shall we continue? No smiles, only selfishness. Okay. Where are we? Yeah, we are here, right? So tell me, what are the principles here used to identify the answers?
But Father, I have one doubt in option A and C. Still, we have the 4 right. So I be a bit confused.
A is
Definitely
telehealth
the
is
absolute. Yeah.
yeah, telehealth is always
Absolute.
appropriate for managing chronic conditions. Do you have the answer somewhere? In the
No, but
text?
I just don't have. Yeah. Because
Okay. Yeah.
no, my concern is regarding the fan boys. If we, if we choose, without the text,
Yeah.
it may,
That's what I
with
said.
confusion.
Yeah, no. That's why I said if only one option has a fan board.
Oh, okay.
If there are two options, you have to distinguish between two. You'll have to find out. Here, since always is an absolute, you need not look for fanboys at all.
Okay.
Always, the absolutes will always ride over all other principles if the meaning is absolute. The word absolute must be there and meaning must be absolute, then it overrides all other criteria. Immediately you can eliminate. I understand your concern is that 4 is here, fanboy is here, and 4 is here.
Yes,
Okay.
Father, yes.
But then this 4 is not used as fanboy, that I'll teach you later. It's not used as conjunction. Are they connecting two sentences?
Okay, like that. Okay.
Yeah, that's okay. Don't worry. Gradually we will learn that. This is not a conjunction. Conjunction means two sentences will be connected with one connective word. That is known as conjunction. She is healthy, but she did not come for duty. She is healthy, but she did not come for duty. She is healthy is one sentence, simple sentence. She did not come for duty is another simple sentence connected with what? She is healthy and she attends every OET session or all the OET sessions and is conjunction. Got it?
Yes, sir.
Oh,
Yes, Father, I understand. Thank you, sir.
yeah. And don't worry, you will not be absolutely perfect with one session, okay? For OET. Gradually, you'll be understanding all these basic nuances. But here, whenever there is an absolute word in any of the options, and if the meaning of the whole sentence is absolute, immediately you can eliminate that option and it overrides all other principles.
Okay, Father.
Maybe fanboys are there, some other things are there. Okay, anything. Now here, 3 absolutes, right? So do you need to go to the passage?
No need.
No need. Even next principle. See, there is an absolute here in the right option. All. But then the meaning is not absolute. So that is not considered as an absolute expression. Okay, telehealth is not suitable for all situations means telehealth is suitable for some situations. Second principle. Third principle. If there is a fan bar in one of the options, that must be the right answer. If there are fanboys in other options, here we have only one fanboy. Okay, then that is another clue that is the right answer. Okay, then if at all we go to the passage, if there is a contrast word, there is a contrast word, whatever comes next to the contrast word will be the answer. If there are 2 contrast words or more contrast words, whatever comes after the second or the latest contrast word will be the answer. So how many principles in one question is it? If you miss one strategy, you can use the other one. For example, you did not understand the absolute here, you can understand contrast word. Then do you need to read rest of the thing?
No need to read. Yeah.
No. Yes. So that can be eliminated. Even you may not read the whole paragraph text at all. Yes, so how beautiful. Okay, so this is like this. Next one. Do you have some energy?
Yes, Father.
Yes, Father.
Yeah.
Father.
Now, see, if there are beginners, I am just showing you. Eliminate the absolute means the extreme poles, top extreme and lower extreme. These are known as the scale expressions, always, often, most of the time, sometimes, seldom, rarely, never. Always means 100%. Always. That is an absolute. If that appears in an option, and if the meaning is absolute, immediately eliminate that option. Never is this extreme end. Okay? Surgery can never heal heart problems. That's a very absurd statement. You cannot say that. So those are the extreme poles we call POLES, extreme poles. One more example. All 100%, most means 90, 80 or 90%. Many means more than one. A few means some. Few means zero. So all and few are extreme poles, and if all or few appear in any of the answer options, immediately you can eliminate that answer option. Thank you, Anu Sabin has purchased. Madhushri has purchased 100 rupees. Yeah, Anu Sabin 1.99, almost 2 pounds. Yeah, nearly 200 rupees. Thank you, Anu Sabin. Jomon Sebastian, yes. That is Australian dollar too. Okay, thank you so much. Yeah. That's great. Thank you. Thank you for your concern. Nancy George, yeah, 40 rupees. Thank you so much. Yeah. For people. Yeah. Others will be, maybe they're not reflecting, gradually it will reflect. Thank you for your support. Yeah. Yeah. Now you can keep on messaging and you'll have it down with your messages. So common absolute words. Don't worry about OET reading part C, okay, whether it is part B or part C or listening part B or C. These are the common absolute words, always, never, only, completely, entirely, or none. That can be other, but these are most often these are given. Yes, eliminate the absolute, avoid the north and south options, extreme values. Words like never, all, every, always, none. Any of these words appearing in the answer options, immediately strike it down. Yeah, the expressions are all means 100% is absolute. Most is not absolute, 90 plus or 80 plus, whatever. Majority means 50 plus. Minority means below 50. A few, some means something more than one. Few means zero. So 0 and 100 are absolutes. All and few. Okay. Exception to the principle of absolute. First exception, meaning of the sentence or the answer option must be absolute. If it is not absolute, you cannot eliminate. Meaning of the sentence or the answer option must be absolute to eliminate. If it is not absolute, you cannot eliminate. Exception to opinions. Opinion of some people. You can give an opinion of all the nurses are really wonderful. That's my opinion. But somebody else will say all the nurses are lazy. So different people will have different opinions. So when an opinion is asked, I'll tell you what are the opinion questions, how you can identify them in another session. If there is an opinion question, you cannot eliminate absolute words. Because in opinion, anybody can use any absolute word. That is not a factual statement. That is individual opinion. you don't like nurses or health professionals, you say they are bad. All nurses are bad. Exception one, the meaning of the sentence or option is not absolute. Then you cannot eliminate it. Okay? Yes. Shall we look into this one? Do you have energy or should we stop? When you are exhausted, we will stop.
Okay. No.
It's almost 1 hour, 1 hour, 20 minutes. You can go for 10 more minutes?
Yes, Father.
Yes, Father.
Okay. Yes. Okay. Philippe Hejol's comments in the first paragraph indicate that he believes. What are the hedging words?
Philip Hujol.
Philippe Hejol.
Para.
Whenever there is a name, please highlight the name. That is very, very important. Okay.
First. And then believe.
Believes.
First paragraph.
Okay. In the first paragraph.
First paragraph.
Yeah, beginners. You have to number the paragraphs. Okay, as soon as you get the material, number 1, 2, 3, 4, 5, 6, 7. Because the question most often mentions the paragraph. So immediately you can go to the first paragraph or third paragraph or fifth paragraph. Indicate that he believes. Believes means his opinion.
Opinion.
Okay. First one. No one knows how to prevent plague.
It's absolute here.
No one is absolute, right? No one. Okay. Then everyone has plague on their teeth.
Absolute.
Everyone is absolute.
Only fluoride can remove plague.
Only.
Absolute.
Absolute. Plague is impossible to remove. If you have eliminated all those 3, this must be the answer, right?
Yes, sir.
But don't believe me, okay? Don't believe these people who shout. Okay? You have to believe from your experience. Right?
Yeah.
Now, yeah? Sorry. Yes. Okay, now, if there is a name, what do you have to do?
Immediately go to
Name.
Directly go to the name.
Go to the name. Here there is one name. Then
Down.
there is one
10th
instrument
sentence.
disturbing. Yeah?
10th sentence name.
10th sentence.
Hujol.
Hejol says. Says is
Third last.
synonym.
He says, and the second last sentence.
Who's it?
He
He
says.
says.
According to who's it? According to who's it?
Yes.
This must be L, right?
Yes.
And others.
Roger. He says.
You know,
According to.
Yeah, according to. Yeah.
Yes.
That is the answer.
The plague is inaccessible.
Plague is inaccessible and you can't get to it. Then plague is impossible to remove. If you can't get it to it, if it is inaccessible, you cannot remove it, right?
Yeah.
Yes.
That is known as paraphrasing. So whatever those in the first camp, we don't want what the people in the first camp say. Okay? We don't want others argue. What are they arguing? Okay? We don't want to read all we do not read those things. And also, you see, researcher Philip Hejol, PhD, Seattle professor and a professor of oral science at University of Washington. All these things are not required because they are just subject complements. Whether he is teaching in Seattle or in America or Australia, we are not bothered. Where he is teaching and who is his wife and where is he working and how old is he, we are not bothered. We are bothered about what he believes. Okay?
Okay.
Yeah, dental professionals have debated. We don't want what dental professionals are saying because the question is asking what Philip Hugen believes, right? So we don't require these things. Just ignore whatever others say. There will be many opinions. You have to concentrate on the name. Okay? Exactly how fluoride helps prevent the cavities is not certain according to the job. Okay. Inhibit enzymes and all. It's clear, right? So this is the right answer, right? B, D,
D.
which we selected. And even without reading, we could select it. Once you are competent, you need not read anything of this sort. These things need not be read at all because you know other three absolutes. So you can straight away go to the answer. Then in the second visit, you can confirm whether it is true or wrong if you want. That's why I said time is your greatest enemy. This is how you defeat your time. Does it make sense?
A lot.
Yeah.
Father,
Yes.
Father, this is a Philippi Hujol's opinion.
Yeah.
So the absolutes are not working. This D is an answer.
Yeah.
An exception like.
Yeah. Exception. That's yeah. That's a good question. So we said exceptions. Exceptions mean what? See, your nursing officer says all are supposed to attend duty tomorrow. However, if you have some urgency, you need not attend duty tomorrow. Does it make you? Is she saying that you should never attend duty tomorrow? Did you understand?
No.
There is an announcement. Your nursing superintendent says to the nurses, since tomorrow we have some special program, all are supposed to attend the special program. However, if you were on night duty on the previous night, you are exempted. Does it mean you should not attend? You must not attend?
No.
You can.
If you are feeling sleepy, you need not attend. If you can't attend,
Yes.
you need not attend. But we will be very happy if you attend. So when exception doesn't mean that is not right. Exception means you will have to go to the paragraph and verify. Sometimes the opinion in the opinion questions, sometimes absolute can be used. It is sometimes. Exceptions are always sometimes 10%, not 90%. Exceptions are sometimes. Traffic, all must follow the traffic signals. The ambulance can go on, right, without bypass the traffic signals, right? Ambulance bypassing traffic signals, is it 10% or 99%? Or 1% or 99%? Fast, come on. 1%, right?
Yes.
Hello.
Yes, Father.
You have to respond, otherwise how do I know whether you understood? See, exceptions means it can be possible, it can be right. Other situations, it can never be right. But exception means sometimes it can be the right answer. But
Okay,
if you
Father.
are not bothered about 500 out of 500 marks, you can simply eliminate. If you are satisfied with 450 in your reading, you can eliminate even with opinions. Don't worry. Do you understand what I'm saying?
Yes, Father.
Yes, Father.
Exceptions doesn't mean whenever there's an opinion, absolutes cannot be eliminated. But you should be cautious. You should be cautious.
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 Why? Because impossible is an absolute. You have to ask such questions, then only I can explain. I understand you did not understand. Impossible is absolute, right?
Yeah.
Yes, Father. Impossible is
Yes.
absolute.
Yes.
But we have selected that as the right answer. Plague is impossible to remove. That is an opinion. So we
I
have
think
selected a word with absolute expression as the right answer. That is accepted. Otherwise, you'll have to eliminate all the 4 options, right?
yes. But I
don't
think
know.
further, this impossible here is you see where we have gotten the answer, the plague is inaccessible. It is paraphrased.
Yeah. But then the word
It's
itself is
paraphrased
absolute, right?
and
That you understand when you go
it's
to
the
the text.
opinion.
That you understand when you go to the text. But word is absolute, right? Impossible.
Yes.
If somebody says cancer is impossible to cure, absolute, right? Do you understand what I'm saying? Place is impossible to remove if you don't read the passage. Before that, it looks even impossible is absolute. Since it is an opinion of Philip Hugel believes, says it is an opinion question. Since it is an opinion, even that can be the right answer. An option with absolute expression. Did you get it?
Yes.
Yes, Father.
Yes, Father.
Yes, Father.
Yeah, that is excellent. This I am stressing because in one of the groups I have seen continuous, maybe the whole day yesterday and night, there was a discussion about these things. Okay?
Okay.
Yeah, I have sent a notice to them, but none of them could attend, I believe.
Okay, Father.
Is this clear?
Yeah.
Yes, Father.
If
Yes,
this is
Father.
not an opinion question, D will be eliminated immediately. If this is not an opinion question, since this is an opinion question, D is right. Clean? Okay. Do you have any more concerns about it?
No, Father.
This is applicable to reading part B, reading part C, listening part B, listening part C, everything. Okay, I'll show you later. Now, do you want to go for one more question?
Yes, Father.
Yeah.
Whatever.
This is from part B. Okay. What does the policy for manual handling equipment tell employers? What are the hedging words? Tell me when you are exhausted, okay? You should not be training yourself. Then you'll feel you will hate OE.
Policy.
Okay, policy, okay. Type of document, policy. Then
Handling of equipment.
Handling equipment.
manual handling equipment or handling equipment. Tell employers. What is it telling the employers? It may, the manual policy may tell many people, but about the employers. First one, all areas of the hospital should be fitted with overhead rack.
All.
Absolute.
Absolute.
All is,
All areas.
Absolute.
Absolute.
I think this must be from the official OET material. Thank you for this for this purpose. So we are happy we have eliminated one. Don't believe me, okay? Don't believe those people who are shouting absolute, absolute. From your experience, you have to convince yourself. Option B, assistant devices should be used over physically handling the patient.
Assistance. Physical
Assistive
handling.
devices.
Should be used for
Physical handling.
Physically handling.
physically. Yeah, then option C, patients have the final decision on how they should be assisted.
Further,
Patient.
maybe
Patients.
They have the final decision. So, do you
decision.
agree with that? As a health professionals, everything will be done according to patient's opinion?
No.
No.
No. Yeah.
if
Okay.
we
From general knowledge, always they are not the final words. We may consider their words. So, if that is the case, this is the right answer, right? No, just
These
for
are
fun sake.
manual
Well,
handling
then,
like
let's read. Don't believe these people, okay? Don't believe me as well. Don't believe EduSkills as well. Be convinced with your work. Yes. Just read policy for manual handling. Find out where is the answer.
policy for the manual handling equipment. The provision of ceiling hose technology and air-assisted patient lifting equipment should be considered as first-line handling aid by employers, as significant evidence exists that their use reduces operator and patient's injuries. Overhead tracking should be installed in all new or refurbished facilities. This should cover beds as a minimum, but should extend to en-suites and other areas of the facility where patients are likely to require assistance. Once an assessment has been made that equipment should be used for safe patient handling, then equipment should be made available and used even in situations where the patient's preference is for it not to be used.
Even if patients say don't want to use it, what you have to do? Last sentence is opposite of option
to
C,
find.
right? Yeah.
Yes, sir.
Opposite. Then where is the answer? Assistant device should be used for physically handling the patient.
Yes.
Should be considered as the first line handling aid by employers. Right? Here you see overhead tracking should be installed in all new or refurbished places. All is absolute. Is it absolute? The meaning? Overhead. You do not worry about absolutes in the text, but I want to know whether you understand the meaning. Overhead tracking should be installed in all new facilities. Does all mean 100%?
yes,
Then this must be right. If all means 100%, all areas of the hospital should be fitted with overhead tracking. Then A will be right. Do you understand? I'm speaking about this option. Option A.
They are asking all areas, and here is all new.
Yeah, all new areas means not all areas. All new rooms means not all the rooms. Did you understand? Overhead tracking should be installed in all new or refurbished facilities. Looks like all areas of the hospital should be fitted with the overhead tracking. But they are not safe. All new areas and all areas of the hospital.
Area.
New or refurbished facilities areas are not all areas of the hospital. Only some areas of the hospital. Got it?
Yes, Father.
Yeah. Even before reading, we got the answer, right? So simple.
Yes.
This is from the official. Then why should you read? Why should you worry? Why should you say reading is challenging? If you have any challenging material, you can send me, okay? No problem. We'll work it out. So it's B. Want to go more? Whenever you are tired, you have to stop, okay? Because you shouldn't be straining your brain with all things. Do you want to go further? Or we'll give you homework?
We can.
What do you say?
further go further.
Further? Okay, one more we will do. Then the rest we will give you some homework, okay? The purpose of the notice is to explain to occupational therapists that. What are the hedging words?
Purpose of notice.
Purpose of notice. Then
Occupational therapist.
Occupational therapists.
okay. Option A, confirmation of the equipment is subject to availability at the time of request.
Confirmation of equipment.
Okay. Then option B, mattresses are of standard size, so may not be suitable for all bed types. Absolute is the right.
With absolute.
But it is not meaning it's not absolute.
Not suitable.
Yeah. If the meaning is, if the absolute is given and the meaning is not absolute, what is the criteria?
So maybe answer.
Right answer. Answer means
That must be the right answer. Don't believe me, okay?
Mm-hmm.
That is a trick they play. Giving one absolute and immediately, oh, really get that. Right answer. Don't believe me?
patient
Just
factor.
patient factors must be considered prior to lodging a request form.
Patient factor.
Okay. Occupational, the notice says, occupational therapist, equipment request form for pressure care mattresses. If you know, heading is very important. We will teach you that.
Yes.
Equipment. Equipment is the main word here, right?
Yes, sir.
That tells you patient factor cannot be the main thing.
Mm.
Okay, it's okay. We'll learn it later. Just read and find which is the answer. Don't believe me. Even if I have highlighted, find out which is the answer, A, B, or C. Read.
Equipment request forms ERF for pressure care mattresses. It is the responsibility of the occupational therapist attending to the individual patients to submit an equipment request form based on equipment eligibility criteria. A pressure mattress may be appropriate when someone is at risk of a pressure injury as evidenced by documented sound clinical reasoning, and their pressure injury risk is unlikely to significantly change. Environmental and equipment considerations must be confirmed, such as that the patient's weight is within the safe workload of the equipment requested. The size of the mattress must also be compatible with other bed equipment and accessories, and the patient has been informed regarding the contraindications of placing items, that is continuous products, sheepskins, electric blankets, ill-fitting bed sheets on top of the mattress. Only after this confirmation should an ERF be submitted. Thank you for that.
Yes. What is the answer? Where is the answer?
The size of the mat.
The size of the mattress must
The
also
request
be
form should be
The size
confirmed
of the mattress must.
based on equipment eligibility criteria, means based on the size mattress available. Mattresses are of standard size, so may not be suitable for all bed types. So confirm that your patient's bed type is compatible with the mattress. Then only file the request form. Did you understand? The language is a bit advanced. You will think patient factors must be considered prior to loading a request form. No. Mattresses are of standard size. Even otherwise, from your medical knowledge, you know, there will not be mattresses. If there are 1 lakh patients, there will not be 1 lakh different types of mattresses, right? Can there be? Imagine there are 10,000 patients in your state. Can there be 10,000 different equipments suiting to each one? No. There will be standard size. You have to see what is your patient requirement. Then only file the request form. Based on equipment eligibility criteria, not patient criteria. Not patient factors, but equipment eligibility criteria. The equipment consideration must be confirmed, not patient factors. The size of the mattress must also be compatible with other bed equipment and accessories. So the size of the mattress is standard. You have to see whether those available size mattresses are suitable for your patient. Is that clear?
Yes, Father.
Because they are not saying anything about availability of the mattresses, like they are not mentioning anything. Patient factors must be considered prior to lodging a, but it is not patient factors. It is the equipment is of the standard size. So before you confirm, you have to keep in mind the mattresses, the standard size of the mattress, and compare with your patient requirements. Then go back. Are you clear?
Yes, Father.
Yes,
This is a little bit advanced language. Okay, don't worry. You will improve yourself. Now, the topic sentence controlling idea itself says based on equipment eligibility criteria, not patient factors. Okay. Purpose of the notice is equipment eligibility criteria, not patient or confirmation of request entry. Purpose of the notice. Okay, then before we go, we will come back to that question. Can you see this screen? Different screen?
Yes, Father, I about to ask this one.
You can see this vitamin K administration to newborn infants, right?
Yes, Father.
Can you see that?
Yes, Father.
Yes, you can see.
Okay, that YouTube, which is not visible, will wait for a
The
couple of
answer,
seconds.
Father.
Eh?
The answer.
Yeah, we'll just take 2 minutes and complete this. See now, first method, foreseeing. F stands for foreseeing, you know. Don't worry, even otherwise, when there is a heading, just foresee what will be there. Now here, the paragraph speaks, who must give it? Who must administer vitamin K? Option A says health professionals. Whom? To infants, option C. When? Option B. How? Procedure. The text speaks about it. Now take this one. Who must administer vitamin K? Who must administer? Do you have answer in the text?
No, it's not mentioned.
It is not mentioned at all because the heading says vitamin K administered to newborn infants. Newborn infants are the focus. Okay? Not who has to do it. So it is not mentioned in the text. You can see it again. We will give you this one. And next. Okay. So in the topic sentence, it is to infants, right? To whom? To whom vitamin K must be administered? Administration to newborn infants. The heading itself says, healthy newborn infants should receive vitamin. Healthy newborn infant. The topic sentence itself says, to whom? Option C. Okay, you have written down in your notebook, right? That's why I asked you to write down. Just look at it, okay? Option C. Now, when it is to be administered? When? At birth?
At birth.
Then? At the time of newborn screening?
4.
That is after 3 or 5 days. And in the 4th week. Okay?
4th week.
No later than 4 weeks after the birth. When it is to be given, right?
Yes.
Yeah. Then next is procedure. How it is to be given? Either by intramuscular injection. Okay, then.
Oral.
Or as 2 mg
Oral
oral doses
route.
of oral doses. Okay. Right. Elimination absolutes. Here you see only seems to be first warning I gave you. This is not authentic material. Since I got it from the discussions from the aspirants, I just wanted to tell you. Now, first one is, see, you can feel this is the answer within the first month of birth. Okay. But then the policy recommends, and the heading says, vitamin K administered to newborn infants. Newborn infants is the main theme. Okay. Not when it is to be administered. The main theme is who has to be given, how it is to be given. And when it is to be given is secondary point. So option C is the right answer, but all of you have opted, majority of you have opted for B, right? Such confusions will not be there in the authentic material. Now you can say B is right because they say within given at birth, okay, and at the time of newborn screening, then in the 4th week, and no later than 4 weeks
4 weeks.
after the birth. All this means within a month. But that is secondary. That is not the main recommendation of the policy. Policy recommends healthy newborn infants should receive vitamin and it should be administered. How, who, when, all these are secondary things. What is the recommendation? Main recommendation? Healthy newborn infants should be administered vitamin K. Do you understand what I'm saying? So the topic sentence tells you the purpose or the main point or the gist. Other things are secondary informations. So the examiner might be assessing whether you can differentiate between primary, purpose, and secondary informations. Okay? See, there is an announcement. All the health professionals will be given a Onam gift or a Diwali gift or a Ramzan gift, festival gift. That is the main announcement, right? What is the gift? When will they give? How they will pass it on? All these are secondary informations, right? But the main announcement is all health professionals, all the nurses will be given a festival gift or bonus. That is the primary information. Other things, when, how, who will give, all these are secondary informations. So when they ask what is the policy recommendation, you have to choose the primary information, not the secondary information. What is the primary information here? Only if they are healthy. Only is not absolute, because the meaning is not absolute. Healthy infants are some. Unhealthy infants are some. So the meaning is some, not 100%. Is that clear?
Yes, sir.
Then if you know model, you can eliminate with the model verbs as well. What is the model verb? Recommends. Recommends is should, right? Advice, recommendation, should. But here it is saying required, imperative, requires, all these must. All these are must. So the recommends synonym is should. It is not mandatory. It's not imperative, must. Required and imperative are synonyms of must. But the policy recommends. Recommends will go with should. Don't worry, beginners, don't worry, okay? We will be dealing with it. Okay. Cool, that's the end of it. Any concerns, anything you want to ask? In India, it is time for lunch. Shall I stop sharing? Okay. Anybody who wants to join here in Zoom session, I can just post if you want to ask something directly. Will be closing once I post the Zoom link in the YouTube comment space. I'll be closing the YouTube. No smiles? Tell me, how do you feel? I have posted the Zoom link in the YouTube comment space. If you want to ask me directly something, you can come here. Okay. I have repeatedly posted the Zoom link. Yes. Yes. Yeah. Yeah, if you have any concerns, you can ask me now. We will be. Yeah, thank you for those who purchased Super Chat was there. Then did I leave somebody? No. What more was there? Yeah, that is at LPS, which Malus, thank you. Super Chat. I don't know. Elizabeth Rome, Roman Sebastian. Yes. See, there are only, we started with 35 people, there are only 13 people when we ended. Then you say you should pass OET. How is it possible? Hi, Junior Elizabeth. Yes. Hi. 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 Good smile. Yes.
Yes.
And that's the attitude. You see, I am sitting here for last 2 hours. Even the learners, they will come and go. They will attend half an hour, then they will skip and go. How they improve? Because every session is a package, right? You need your overall team. Yeah, we will be closing the live now. Anybody wanting to join, you can click on the link. You can come here. Thank you for the wonderful session. Hi, Father. Yes. Yeah, Adira Ranjit, thank you for the super chat. I wish all purchase one super chat at least 10 rupees. It's just 10 rupees or 20 rupees. But majority are selfish, right? Out of 35 people, only 5 people have purchased. Yeah. Many, can you just take down those names of those who have purchased super chat names?
Oh, okay.
You can see at the YouTube comment space, right?
Yes, it is.
Just later you can just say. There will be special consultation on special sessions. Anything you want to ask me? How do you feel? Tell me some response. And this is almost the starting of the new batches, okay? Since we have not confirmed with the participants, they are discussing in the batches. We have put in general. Otherwise, we will have 7 to 12, 7 a.m. to 12 p.m. classes for OET special batch, OET general batch, and OET beginners batch. Anything you want to ask me? Nothing? I am ending this live stream, okay? So anything else? Mini Jackson? You're still waiting, right? Please go.
Just 1 second. I need to write
Yeah,
them.
yeah, it's okay. Yeah, I'm waiting. I am waiting. Once you have done it, tell me. Okay, I'll go.
Good afternoon, Father.
Yes. Very good afternoon. Manjushri, right?
Yes, Father.
How are you doing? Yes. How are you
It's
doing?
complete, Acha.
Okay. So we are ending the YouTube stream.
Acha, focus